We have different ways to assess the bleeding risk, but the most accepted way up to now is to use the Hasbled score, which is very well known, and it has been proven in very broad series in Scandinavia, Denmark, Sweden. So it's validated and it's accepted as the gold standard in this moment. We have identified different antidotes. We will have them very soon available for everybody. Up to date, they are available only in investigational purposes, but also in very, very few weeks are going to be at the market in some countries. Now the action way is different. We have two families. One is an anti-10A inhibitor, and the other family is anti-2A. This is the bigatran, the only one in this class. So the action mechanism is different. However, the clinical results are very good with both sides, with both strategies. Some of the drugs have really improved safety, whereas others have improved safety and efficacy. In my opinion, there are slight differences between all these drugs, so you can choose for your patient, concrete patient, which of the drugs you would take. However, as a group, both families are excellent and a great improvement over warfarin, which was our gold standard during 50 years and has a lot of clinical limitations that can be avoided with these NOACs, with these new drugs. Unfortunately, this is what we are seeing that it's happening, and we have not yet controlled. Age is a key factor for developing atrial fibrillation, so people are living longer, and this is just this point brings the prevalence of atrial fibrillation higher and higher. However, there are other factors that also influence the probability to develop this illness, as hypertension, which is also very linked to age and to diet and several other genetic factors inclusive in different countries. So our prevision says that it's going to increase. Preventive measures should see the person as a whole, not only treat the arrhythmia. If, for example, if a patient has hypertension, then you should, of course, prevent all these mechanisms, these background mechanisms that help for the development of atrial fibrillation. However, age is impossible to prevent.
Do guidelines for stroke prevention differ between Europe and America?
In my opinion, not very much. There are some differences, but very, very small differences. And also there are differences in the drugs approved or the dosages of drugs approved in different countries, but mainly are the same.